Hi, so in this case, Pamela is receiving services from occupational therapy, speech therapy, and physical therapy. Each of these are members of the rehabilitation team, and it's super common for patients in acute care to see these three disciplines. They work closely together, they can even co-treat if indicated, and they're each experts on certain areas that benefit this patient. One of the great things, though, about OT is that all the activities that these disciplines have worked on are within the OT scope of practice, but this doesn't mean that we're the best person to address each area, which is why that interdisciplinary team is so important. In this particular case, what the OT would do is focus more on the ADLs, such as grooming, hygiene, toileting, self-feeding, all of those daily activities that possibly need modifying so that Pam is able to do them again since she is so weak from her chemo treatments. And an OT would also look at building her activity tolerance so that she is able to perform those activities. And OT would also, in this case, Pam is experiencing pain at least a 5, 7 out of 10 with each session. So an OT could address pain management. And this could be through something as simple as breathing techniques or even simplifying activities and possibly even trying to alleviate some of her feelings of anxiety and depression that are so common in this population. An OT could also refer her to a psychiatrist if she's not already seeing one. An OT could also look into some support groups for Pam of other people who are experiencing the same thing that she is. So what the PT would do in this case is focus more on the ambulation and endurance of this client. So Pam's goal is to ambulate up to 50 feet without the assistance of her husband. And she was given a front-wheeled walker for this instead of a cane. So the PT would work on that ambulation and training of that new assisted device, which is the front-wheeled walker. They would also work on strengthening of her lower extremities, her balance, dynamic and static, transfers, and yes. The speech language pathologist in this case would work more on that swallowing aspect. Pam's having difficulty swallowing. She can do it, it doesn't hurt, but she just has a hard time doing it. So this could mean that the speech therapist might need to do a swallow study. Or maybe she needs to modify the diet for her to have her liquids thickened or even her solids pureed so that that swallowing is easier to do. In this case, there is enough overlap that co-treatments could maximize the amount of time and sessions that the rehab team has with her. So if an OT and a PT were to do a session together, one thing that they could work on is something as simple as having Pam ambulate to the sink using that front-wheeled walker, and then having her brush her teeth at the sink, and then go back. So the PT would look at that ambulation, getting her to the sink, up out of bed to the sink, using that walker, and then her balance while she's at the sink and brushing her teeth, and then how she turns and goes back and does stand to sit back into bed. And the OT would look more at the activity of brushing teeth in itself. Like, does she need a different kind of toothbrush? Does she need a different kind of even cap on her toothpaste, like in a flip top instead of a twisty? Possibly a built-up handle. How can she modify it so that it's easier for her to do? And so if there's two of them, it's also nice to have an extra set of hands since she is a fall risk. And if OT and speech were to do a session together, they could do a feeding session with her since she is having trouble with that self-feeding and that swallowing. She's choking and she said it doesn't necessarily hurt, but it's just hard to do, and feeding should be fun. It shouldn't be hard. Otherwise, it's just a chore and she's just going to keep losing weight, which is just bad all around. And so the speech therapist would handle the swallowing itself and look at how she's swallowing, like what phase of swallowing, or where is she having the issue, why is she choking, is she aspirating, and that if she does a swallow study, those results could help with this session. And the OT would look more at self-feeding through utensils, like holding them. She's having trouble manipulating them. Is it a fine motor thing? Is it just the weakness in her hands? Does she need alternative feeding utensils so that she can do this? Does she need to change the way she's sitting, or even what kind of table she's sitting at? Like by looking at her posture and how the activity itself. An OT would do an activity analysis to see where recommendations could be made so that she can feed herself easier. To communicate between the disciplines, I think writing on a board in a patient's room is a good idea. If one professional went in first, they can write what they did that day, what went well, what didn't, and then the goals that each professional has for this client so that there isn't a lot of overlap. And if the rehab team, before they even see this patient, if they could just meet for like 5 minutes and to talk about what they kind of plan to work on. Sometimes plans don't always work out, especially in acute care. A lot of times you have to think on your feet. You're coming up with something right then and there. But you can have a tentative idea, and they could just talk about it. You could find out if a co-treatment is indicated, and then find a time to go see her together. And then back to like that writing on the board thing. That helps also the nurses, the doctors, any other members of who's seeing Pamela know what everyone else is doing. And then the nurse could kind of decipher what is on the board for the family members. They know what's going on if they weren't there for the therapy session. And also it's important that each member communicates with the family or the caregiver about how to work with this with Pam, because her next level of care, it could be home, it could be home health, or like she'll go to home with an outpatient facility, home health, skilled nursing, acute rehab. It just depends how she performs in therapy. But that caregiver is going to need to know how to help transfer her, and just general education about her condition in general, and making sure that she has the support she needs. In this case, I do think that the OT is the most relevant. I might be a little biased, but if there was a choice between receiving services from a PT, an OT, or a speech, I would want an OT, just because there is such a wide scope of practice, and an OT can work on transfers, that ambulation, using assistive devices, activity tolerance, ADLs, pain management, all of that. But because we're a more holistic perspective. But it's great that in this case Pamela has all three, because that is definitely going to get her where she needs the fastest. So that's it. Thank you.